messaging in Vietnam, and we use a media content analysis to do that because we see that firstly, we see that breast cancer is on increasing trend in the world, and it's contribute to the worldwide burden of cancer, and especially breast cancer. And we see that approximately 70% of deaths from cancer occur in low and middle income countries, including the breast cancer. And late presentation and inaccessible to diagnosis and treatment are very common. And it's also happened in Vietnam. In Vietnam, breast cancer is the first leading cause of cancer among females. And we can see that the statistics come very quickly from 1990 to now. And we see the low levels of knowledge and awareness concerning breast cancer in general population. Here you can see the stage of diagnosis, and we see that on the first column, on the first row, this is about the breast cancer. And about 50% of patients was diagnosed when they are a stage of third and fourth, which is almost incurable disease. So we are thinking about doing a health communication on breast cancer to raise awareness and reduce stigma against breast cancer. But first thing, we need to do a baseline survey to understand how people are aware about breast cancer. And we come up with the idea of doing a media content analysis, because we see that in Vietnam, people are very accessible to media. And media is also a very crucial channel for health communication. So we first come up with doing analysis of media content on breast cancer. And here you can see that Kimberly said that research consistently has concluded that health-related content in popular media is problematic from health promotional standpoint, and that media representation are still suspects, fraught with inaccuracy, misleading, and problematic themes and images that stereotype and stigmatize. This is what we already know, and we want to come with media content of the newspaper in Vietnam to see how the problem, how the issue going. So we set the objectives of our study to investigate and understand the content of messages concerning breast cancer in online Vietnamese newspaper. And the study investigated what was being shared, for example, the textual content and images, and how it was shared, the testimonies, the statistics, and the level of accuracy, and what could be learned about how breast cancer is presented within Vietnam. We use a mixed method media content analysis, and our quantitative tool was based on Hinton and colleagues to measure media content on obesity in UK newspaper. And then we adapt to breast cancer in Vietnam. We including the data box for key codes and reflection, and also the codes for images. So we came with the 6 most popular Vietnamese online newspaper, and noted that all these newspapers have the print version. It means that people who cannot access to the internet can also access with this newspaper by buying a hard copy of that. We only come with online newspaper because it's already available, and it's just the same with the print version. Here you can see the information of the 6 sources of newspaper that we use is VN Express, Vietnamnet, the Intellectual, the People, Health and Life, so the women. This is the most popular newspaper, and also it target to health, and also target to the women issue. We come to these 6 sources, and we search for the term breast cancer and cancer. And with the inclusion criteria was that any media content, including articles, opinion, Images that focus upon or include specific information on breast cancer will be included in our search. So our search returned in 129 eligible articles and 237 relevant images. We see that the theme of the article about breast cancer come into the 5 different themes. As the first one is prevalence of accurate and factual information. The second is the limited information concerning screening. The third one is positive coverage regarding treatment. The fourth one is emphasis on diet, which we didn't expect to see, but it returned in many articles relating to this one. And the fifth one is limited personal stories and experiences. For the headline, we're rating headlines, and we see that almost half of the articles have a neutral headline. The other 32% have reassuring tone, and the other around 20% have alarming tone. For the style and tone of the paper, so the article tended to be largely medical and neutral in style and tone, and the voices cited in the article tended to be expert. So some of the paper is really hard to understand, even for me, a public health practitioner who are not really very medical. The other point that we see is that some of these articles refer to expert generically, for example, as recommended by doctor, women under 50 years old with thick breast tissue forming a lump should have mammography or ultrasound to screen for cancer. So it is something very expert. Other articles refer to information from specific Vietnamese doctor, where a large number of articles refer to statements made by doctor not from Vietnam but international, for example, US, Australia, the UK, or Singapore. And many articles additionally included a comment or advice from the Vietnamese Ministry of Health. So it's generally accurate information, but not very friendly to readers. We also do some frequency counts of some specific content in our media article. For the topic of prevention, risk factor and symptoms, we see that about 40%, 44% of the paper, they use factor information on breast cancer incident rates in Vietnam. Another 53%, they mention about correct identification of symptoms. Around 40% of the paper, they mention correct identification of risk factors for breast cancer. The number of the paper who provide misleading information is very little. We see only 1.6% of the paper mention about incorrect identification of symptoms, and another 7% of paper mention about incorrect risk factors. For example, they say that eating breads can come up into a higher risk of developing breast cancer, something that very shocking you, but this is not true. About screening, we see that screening is the badly needed thing for the prevention of breast cancer, but it's not very well documented in the articles. We see that only nearly 40% of the paper mention about screening for breast cancer. Not enough, 20% of the article describe what is involved in the screening procedure. So they mention about screening, but they do not really go into the screening, what will happen. And many women thought that mammography is something very disaster, very hurt. And another 20% mentioned a location where women could access screening services. So some of the women, they very lack of information and about the service, about what's going on during the screening. Something that I think that is a gap. So we see that in other countries, the average age of being diagnosed with breast cancer is like 65 years old. But in Vietnam, the experts recommend that 40 to 50 years old should do the screening. And we also see that in some cases, the patient are diagnosed when they're still very, very young. For example, we have just witnessed a 7-year-old girl have breast cancer, and it's really shocking. Information on self-examination is frequently included topic, and many articles provide very detailed instruction on how breast self-examination should be conducted, which is really good. About the treatment, we see that 46% of the paper discuss treatment in a reassuring terms. Another 22% discuss treatment in either alarmist term or focusing on the negative side treatment of effect of treatment, for example, losing hairs, pain, scarring, and another 20% mention a location where women could access screening services. Content about lifestyle and diet and exercise. This is really take into a huge account of the content of the media about breast cancer, which we did not expect at the beginning of the search, but it returned in many. So we see that over 1/4 of the article explicitly reference lifestyle factors such as diet in relation to prevention, treatment, or recovery. For example, we can see some quotes that we cut from the paper here. For example, they say that in the paper, in order to reduce the risk of getting breast cancer at a young age, you must recognize the importance of having a healthy diet through including green, fresh vegetable in your daily meal and avoiding such things such as glucose or cigarettes. I think which is good. But some of the paper return in avoiding of something not very well documented. For example, avoiding bread, avoiding food with high hydrocarbonates. I'm not sure if it's really accurate or not, but it's still presented in the media. The other aspect that we really want to see is the personal stories and experiences. We see that in Vietnam, many women come into a catastrophic situation when they have the disease. For example, the husband can say divorce immediately when his wife got diagnosed with breast cancer, or people usually think that breast cancer is a death a statement and it's the end for a life. So it brings women in general and women especially having breast cancer a very very bad mental health, and we want to see how the media say about that. So we see why there is relatively high coverage of factual information about breast cancer symptoms, screening, diagnosis, and treatment option in Vietnam. There's a very noticeable lack of personal story and experience of women with breast cancer. And we want to see more positive experience and advices from the breast cancer survivor. We can support other patients and also reduce stigma with this disease. I myself haven't thought that breast cancer can get such a huge stigma like this. I used to work with a breast cancer survivor, and she said that she wanted to open a coffee shop, and the landowner almost offered her the contract. But when he recognized that she's a breast cancer patient, he say no and he canceled everything. So it's really a stigma. We can see in the chart here is the personal story and experience already mentioned in the media that we can cut up. So only 5% of the paper mentioned about economic challenges that a patient can have to overcome. Another 3% mentioned about experience of financial catastrophe from paying for treatment. and noted that in Vietnam, the health insurance covers 80% of the cancer treatment, but and also the coverage of health insurance in Vietnam is 90%, so it's quite good. But still, the women who are the most vulnerable group, the poorest group, they still don't have insurance. So it's really costly and cause financial burden for the whole family. The article also mentioned about 8% of the women facing social stigmatization or discrimination. Another 70% of the paper mentioned about intimate relationship breakdown. And 6% of the paper mentioned about the aesthetics impact of treatment and challenges it creates for women. So it's also good information to provide, but still very little, and it almost to be negative than positive. We also do the analysis of images in the article, and we see that more than half of the paper they use irrelevant images. For example, they use either screening. The article focused on screening, but they use the image of a woman with breast cancer, so it's not really relevant. And only 44% of the paper use relevant paper that only designed for that for this content of the paper. We can also see a very strange thing that we don't see much of the image of the Vietnamese woman in Vietnamese newspaper, but we see the images of white women. We see that 21% of the paper they use the image of women. 7% of paper use white women in non-medical photos, and 5% use white medical professional, and 10% of the paper use white Western celebrities, which is not really relevant to Vietnamese culture. So what we can conclude from that, given the finding from other study indicating low levels of knowledge and women with breast cancer experiencing stigma and discrimination, we need to have more non and in-depth narrative focused messaging to promote a better health communication and message on this breast cancer. Yeah, so thank you for listening, and I expect for questions from you. Thank you.
Okay, thank you, Doctor. If anyone has any questions, please go ahead. Please drop your questions in the chat box so that Doctor will be able to respond for your questions. I repeat, if anyone has one, please go ahead. Please drop your questions in the chat box. Okay, it's like no one has any questions. If you have any questions further, we'll drop the mail ID of Dr. Dinh so that you can directly contact her through mail ID. Thank you, Doctor. Thank you for your valuable presentation.
Thank you.
Okay, we'll move forward for our next presentation that will be given by Dr. Andriy P. Kozlov of St. Petersburg Polytechnic University of Russia. The title of her presentation will be Human Orthologs of Fish Tumor Specifically Expressed Evolutionarily Novel Genes Participate in Adipose Development and Functions.
Hello, everybody. Can you hear me?
Yeah, I can hear you, but I couldn't see anything. It's just like white page.
I put it on my screen. So do you see the slide?
No, nothing. It's just a blank one.
Okay. I see my slides on the screen. So
Down below, there will be a share screen option. There you can find the presentations option. In the bar down below, you'll find the share screen option. Click on that, and there you'll find your presentation. It's still the blank one.
and see, I will open it now.
Okay.
Is it? Do you see it?
No. It's only just blank whiteboard.
So what can I do?
In the basic option, you'll find your presentation if it's open. If you click that, we'll be able to see your screen.
I see the blank now, and when I'm opening my presentation, I see it, but you do not see it.
Yeah, you just open the whiteboard one, that only we are able to see. Or else open your presentation, then you go for the share screen option. If you click that, you directly see that your presentation there.
Do you see it now?
No, it's just only whiteboard still.
So I don't understand what's going.
You already, once you open your video presentation already open, then click the share screen option. You can see that your presentation in the basic option.
I can see basic option here.
There you'll find your presentation. Click, and we will be able to see your presentation.
Hold on.
Hello, doctor. Once you exit that and reopen it again, then you'll be able to find the presentation. Then.
Сережа, я вижу свою презентацию, они не видят, что делать. Они... Ну, так... То есть я нажимаю... Куда смотреть-то? Вот файл... Вот я запускаю ее. И что? Я его вижу, вот он раскрыт. Запустил демонстрацию экрана, и что? Совместное использование, все у меня есть. Включить видео. Сейчас, подожди, вот я включил видео. Вот я включаю видео, оно выключается, зараза. Вот камера FaceTime у меня. Hmm?
Hello, Dr. Andrew P. Kozlov. If you're not able to do the share screen, we'll play it on your behalf.
All right, I can't.
Once you exit that window and try again so that you will be able to find that option, I guess.
Right.
If you want us to play your video, we'll do that for you. Do you want us to play, Doctor?
I'm sorry, I cannot switch. I'm switching. It doesn't work. So I'm sorry. Can you put on the video which I sent before?
Yeah. That's what I'm saying, Doctor. We'll play your video on your behalf.
Yes, please do. Mhm.
Yeah, thank you, Doctor.
Mhm.